At CHR Connecticut, our goal is zero suicides. Suicide is currently the 10th leading cause of death in the United States according to the American Foundation for Suicide Prevention. Those reasons and more are why CHR started the Zero Suicide Committee. Our goal is to spread awareness, educate, and to continue preventing suicide. CHR is part of the Connecticut Suicide Advisory Board working to prevent suicide in the Manchester area and beyond. At CHR, the Zero Suicide Committee is working to save lives of people of all ages by leading system-wide culture change committed to reducing suicides, training a competent, confident, and caring workforce, identifying patients with suicide risk via comprehensive screenings. This means that every person of all ages who is seen at CHR is screened for suicide risk at every visit. We want to do everything we can to identify the risk of suicide and provide immediate help to prevent suicide. Engaging all individuals at risk of suicide using a suicide care management plan, treating suicidal thoughts and behaviors using evidence-based treatments, transitioning individuals through care with warm handoffs and supportive contacts, improving policies and procedures through continuous quality improvement. It's really a system-wide priority. We want to do everything we can to help individuals and families who come to us for care. How much of a problem is suicide in the state of court? In Connecticut and across the country, there has been a startling uptick in deaths by suicide. Suicide rates among all ages have increased by an astounding 33% since 1999. 90% of CT deaths by suicide between 2015–2017 occurred in people 25 years of age and older. 49 was the average age. Residents ages 45–64 years old had the highest rate of suicide, followed by residents 65 years and older. There were 4.5 deaths in CT in 2018 from Hispanics for every 100.000. What other facts on suicide should our listeners know? Sadly, suicide is now the 10th leading cause of death in the U.S., and substance use and depression are major risk factors for suicide. Suicide is the second leading cause of death in 15–29-year-olds in the U.S. Someone attempts suicide every 31 seconds and 113 Americans die from suicide daily as their population most affected. The most affected people are those with PTSD and substance use disorders, the LGBTQ population. Both young and adult are also at high risk. Individuals experiencing life stressors as well as having access to lethal means such as firearms or medications increases their risk for suicide.